Now that you understand the natural menstrual cycle and the options for genetic pre-screening, we will look at the process known as controlled ovarian stimulation. It differs from the natural menstrual cycle because instead of allowing the ovary to produce a single egg, the ovary is stimulated with medication to produce multiple eggs at once. By increasing the number of eggs produced from the ovaries, we aim to increase the number of high-quality embryos for transfer or freezing, which can then lead to the highest chance of a successful pregnancy and healthy baby. The controlled ovarian stimulation process can be divided into 3 phases: suppression, stimulation, and trigger. The first stage in the controlled ovarian stimulation process is the suppression phase, which has 2 key goals: to prevent the development of a single dominant follicle, as seen in the natural menstrual cycle, and to suppress the release of LH, luteinizing hormone, from the pituitary gland in order to prevent premature ovulation. By suppressing the ovaries, they will respond to the next phase, the stimulation phase, by producing multiple follicles of a relatively even size. Prior to moving to the stimulation phase, the patient will have hormonal blood work and a baseline ultrasound scan to measure the small antral follicles and the thickness of the endometrial lining. Typically, hormone levels will be low, the endometrial lining will be thin, and the follicles will measure less than 10 millimeters. If all is satisfactory, the patient will progress to the stimulation phase. The stimulation phase is achieved by the injection of FSH, follicle-stimulating hormone, the same hormone as produced in the natural cycle. The amount of FSH injected is chosen carefully in order to try to achieve the optimal number of eggs for an IVF cycle, typically between 8 and 20, but this can vary in extremes from no eggs to as many as 50. This variance is due to the ovarian function of the individual, the dose of medication, and the protocols used. The stimulation phase will typically take between 8 to 14 days to produce mature follicles, with once or twice daily injections of FSH, depending on your body's response. During this time, you will be closely monitored and undergo both blood tests and transvaginal ultrasounds, about 5 to 7 times over the 8 to 14-day stimulation period. This is to determine your body's response to the stimulation. At each monitoring visit, blood is drawn and your estrogen level is measured on a specialized hormone assay machine. As the follicles develop and mature, they produce more estrogen. Therefore, the estrogen level reflects both the number and maturity of the follicles and the eggs inside. Prior to stimulation, the estrogen level is less than 50 picograms per milliliter. At the midpoint of the stimulation phase, it will be between 200 and 1,000, and by full maturity is usually between 1,500 and 4,000. Transvaginal sonograms visualize the number and size of the growing follicles in the ovary. The developing follicles are measured in 2 dimensions and grow 1 to 2 millimeters a day. After 4 to 6 days, they are over 10 millimeters. After 8 to 14 days, the follicles are fully developed, and the largest will measure between 17 to 20 millimeters. The optimal response produces about 8 to 20 follicles between 15 and 20 millimeters by the end of the stimulation phase. In up to 20% of cycles, less than 2 to 4 follicles develop, which may result in your doctor considering cancellation of the cycle. The likelihood of cancellation is more common in women with decreased ovarian function and in women over the age of 38. If the cycle is canceled, consideration of different treatment or different protocols will be addressed with your physician. The uterine lining grows slowly, and by the time the follicles are at full maturity, the optimal uterine lining thickness will be above 8 millimeters. Will have a distinctive triple line pattern on ultrasound, with 3 white lines visible, separated by 2 gray regions. The trigger drug completes the final maturation of the egg and is administered once the largest follicles reach the optimal size of 17 to 20 millimeters. This allows egg retrieval to be performed 35 to 37 hours later. In some cases, your doctor may wish to check your hormone levels the day after the trigger injection to make sure you properly absorb the drug. The suppression phase prevents the development of a single dominant follicle and premature ovulation. The stimulation phase produces multiple mature follicles over the course of 8 to 14 days. The trigger phase completes the maturation of the eggs in preparation for egg retrieval.